This is Chapter 9, Diseases and Conditions of the Respiratory System, Part 2. We're going to begin with looking at pneumonia, and just a basic as far as pneumonia. It's an infective inflammation of the lungs. It would probably better be referred to as pneumonitis because there is an itis there. It is inflammation. And when I say infective, there's a number of different organisms that can cause pneumonia, and then there's even forms of pneumonia not caused by infective organism. The symptoms are about the same for most types of pneumonia. Most of the patients are going to have at least a cough and a fever and some shortness of breath. With the cough may be productive, which means they may cough up phlegm or expectoration from the respiratory tract. They may or may not, depending on the type of pneumonia. They will probably have some chest pain with the pneumonia. Maybe some cyanosis, which is bluish discoloration of the skin that indicates low oxygen getting out to all the different areas of the body. And according to the type of pneumonia, may have some blood in the sputum. But most people will have a cough, shortness of breath, and fever. The larger area of the lung that's affected, the more severe the symptoms are going to be. A person that has pneumonia may have the pneumonia in just one lung. You have a right and a left lung. And you also have separate lobes of the lung. The pneumonia may affect only one lobe or many lobes of the lung. When we talk about it being caused by bacteria or viruses, also other fungi may cause pneumonia, chemicals that are in the air a person may breathe in may damage their said that wrong twice, may damage their lungs and cause the pneumonia. Inactivity also, a person especially that doesn't move around a lot, that is confined to bed, whether it's after surgery or because of some chronic illness, may develop pneumonia from the inactivity. The organism, if it is infective pneumonia caused by bacteria, could be identified by sputum culture, and that would be that the person coughs up the sputum, and the sputum is examined, and cultures are grown of any organisms in that sputum. It's usually a pneumococcal pneumonia. There's also group A streptococcal, staphylococcal, there's Klebsiella, types 1 and 2. There's a number of different bacteria that can cause pneumonia. And treatment will depend on the underlying cause. When a sputum study is performed, a sputum culture, usually a sensitivity test will also be performed to find out which antibiotic the specific organism is sensitive to, showing which antibiotic should be used for treatment. I want to talk about lobar pneumonia for a minute. Your textbook indicates that lobar pneumonia is a pneumonia that's confined to just a particular lobe of the lung. And that is not how we health information technicians classify lobar pneumonia. Those of you that will do medical coding someday, we do not classify pneumonia as lobar just because it affects just one lobe. When we are coding a diagnosis of lobar pneumonia, we look for documentation that it's caused by the Streptococcus pneumoniae bacteria. And that's what you need to know for this class, that all of you taking this class need to recognize that if I'm referring to lobar pneumonia, I'm referring to pneumonia caused by specific bacteria called Streptococcus pneumoniae. The person, just like with other types of pneumonia, will have fever, They'll have chest pains when they're trying to breathe, but this is a particularly severe type of pneumonia. The respiration rate and the heart rate will be increased. The predisposing factors or factors that make a person more likely to develop lobar pneumonia would be chronic alcoholism, malnutrition, congestive heart failure, fatigue. Lobar pneumonia is not described like this in your textbook, so you need to make sure that you're taking notes as you're listening to this lecture. Streptococcus pneumoniae bacteria causes acute inflammation of the alveoli, which are the tiny air sacs within the lung. A fibrinopurulent exudate will fill those air spaces, and when the lungs are seen on the X-ray film, the radiologist refers to the lungs as being consolidated. Consolidations prominent on the chest X-ray of the patient with lobar pneumonia. Now, the lobar pneumonia is very severe, but is relatively short-lived because the antibiotics used to treat the Streptococcus pneumoniae are usually effective. When the patient's hospitalized with the lobar pneumonia, at first the radiologist describes those chest X-rays as having consolidation, and then before discharge, chest X-rays should show resolution. Return of the lung to normal condition is called resolution. The next type of pneumonia we're going to look at is bronchopneumonia, which is much more common than lobar pneumonia. Symptoms are less severe, and it usually develops a slow, actually longer running course than the lobar pneumonia, caused by bacteria other than Streptococcus pneumoniae. It's a number of different bacteria that result in bronchopneumonia. It's more common in very young people or very old people or chronically ill people, the bronchopneumonia. It's also a pneumonia that may be acquired while the patient's in the hospital, which would be referred to as a nosocomial infection. Nosocomial infections, those are the infections that a patient does not have when they are admitted to the hospital. They acquire the infection while they're in the hospital, so they have a hospital-acquired infection, a nosocomial infection. Patients can acquire bronchopneumonia while in the hospital. They can acquire urinary tract infections. The whole idea is that because of lack of quality care and lack of quality hygiene with the staff and other precautions, the patients actually get sicker after they're admitted to the hospital because they acquire a nosocomial infection like bronchopneumonia. The bronchopneumonia is going to affect the bronchi. It may be just in one of the lungs, or it may be through both of the lungs. Consolidation is not present, though. It's more of a patchy infiltration in the lungs, and that's what you'll see documented on the X-rays. Signs and symptoms, again, the fever is going to be present with any of the pneumonias, the chills, cough, especially in bronchopneumonia. Purulent sputum is usually seen. Tachypnea is rapid breathing, and dyspnea is, again, the difficulty breathing. Treatment's all about the appropriate antibiotics that could be identified by that culture and sensitivity study. Respiratory therapy may or may not be needed. Look at viral pneumonia. There are a number of different pneumonias that can produce, a number of different viruses that can produce pneumonia. Viral pneumonia may follow influenza, because influenza is actually caused by a virus. The virus may work its way through the respiratory tract and result in pneumonia. Both lungs are usually involved with, again, no consolidation. Signs and symptoms about the same with the dyspnea, the fever. Viral pneumonia is the person's more likely to have a dry cough, fatigue, and cyanosis. Once a person has a case of viral pneumonia, they're more likely to contract a bacterial infection on top of that viral pneumonia. So though antibiotics are not effective to cure the viral pneumonia, they may be used just to prevent the person from having a superimposed infection, bacterial infection on top of the viral infection. And then aspiration pneumonia. Aspiration pneumonia results when the person aspirates some type of liquid or other material into the tracheobronchial tree. The person actually, when they're swallowing liquids or some other liquid is in their mouth, it may be vomitous, they breathe in that fluid into their lungs. There's a number, again, of different fluids that the person may breathe in to cause this aspiration pneumonia, and vomitus is pretty common, that the person in a very weakened state that may have trouble swallowing anyway, they may vomit and not be able to recover from that before they breathe in some of that substance. Commonly seen in elderly people who have problems swallowing their food that they're eating. In fact, the person feeding them may be trying to rush the patient to eat and cause them to have that aspiration. Okay, now following in your textbook with pulmonary abscess, an area of contained infectious material in the lung is known as a pulmonary abscess. It's frequently a complication of bacterial pneumonia. Could be caused by some form of bronchial stenosis, a neoplasm, or any other type of obstruction in the lung may result in or may add to that abscess formation. If the person aspirates food or bacteria, an abscess may form around that food or foreign object. The abscesses are more common in the lower part of the lung, and the main symptoms are actually chills and fever. They'll have some chest pain, usually a productive cough, maybe even a purulent, bloody or foul-smelling sputum, because the abscess is formed in there, this infectious area that's growing in the lungs. Treatment depends on the cause. It's almost always going to include some antibiotic therapy consistent with, hopefully, the culture and sensitivity report will be done and the antibiotics prescribed according to that report. Now, as far as treatment, a surgical resection could be performed to remove the abscess in a part of the affected lung, but that would only be performed after they tried antibiotic therapy. Okay, Legionnaire's disease now. Legionnaire's disease was named after a group of legionnaires, a part of a club, I guess I'm going to say. It was actually a convention that was meeting in Philadelphia back in 1976, and about 200 people became sick, and 34 of them died that were at this particular convention, and they traced the organism that was causing the Legionnaire's disease back to an air-conditioned unit, and the water that was dripping from that unit, the stale water, the water was contaminated with bacteria that was breathed in the water droplets, and these people developed these very severe respiratory infections, and again, some of them actually died. So the bacteria contaminate water sources and then are inhaled in droplets. Caused by bacterium Legionella pneumophilia. Though there could be other organisms present, this is the most common cause of Legionnaire's disease. Symptoms, again, are kind of flu-like with chills and fever, headache, dyspnea, maybe even some confusion and nausea and vomiting. and treatment's going to be about the appropriate antibiotics. And erythromycin's often effective in the treatment. Next condition to look at is respiratory syncytial virus. RSV is a common abbreviation that you need to recognize. RSV is more common in the elderly and in infants and very young children. And this particular virus may result in pneumonia. At first, the person will have cold-like symptoms, and it seems just like an upper respiratory infection. But in many cases, it goes on to form a pneumonia. It's very difficult to treat this because it's viral, and it's more of a supportive treatment with antipyretics, which are anti-fever drugs being given like Tylenol or ibuprofen. The person may need some respiratory therapy, may need some oxygen therapy. Antibiotics would be given to prevent a bacterial infection on top of this viral condition. And again, the very young are more likely to develop RSV pneumonia. I'm going to conclude part 2 of Chapter 9 at this time.